Hi. It's quite difficult writing two talks for one day, and so I'm really sorry if there's overlap. I'd like to consider some of the ideas from Act of Hope, the work of Joanna Macy and Chris Johnson. Looking to the future, what do you deeply hope for? Imagine the world you want to be part of, and imagine the medicine that you want to practice. And imagine the part you'd like to play in support of that world. And then think of the steps you'd like to take towards this, starting tomorrow or when you're next going to work. By the end of the talk, I'd like you to know what you want to do and actually have a plan in place. This is Alex. This is what Alex did. He's a patient and a friend of mine, and he was diagnosed with motor neuron disease about 18 months ago. He imagined how he wanted to feel and has achieved that through a combination of bravery, sheer grit, and being part of a fantastic community.
In the water, I have so much more movement than I do out of it. I get a real feeling of freedom.
Yes, and drive your legs.
Probably the biggest feeling comes from stretching my arms out wide, which this is the only time I get to do that. On a really good day, it can feel like I am flying. It's so much of a contrast to everyday life where I am basically sat in a chair. On the whole, I'm coping quite well with accepting my illness, but still some days it's preying on my mind. You go into the water and the cold, and all of those thoughts vanish, and you're just there. You can't really think about the future, which is really good. I'm just on my back and looking up, and on a day like today, I start to be aware of the sounds. I can hear birdsong, I can hear wind in the trees, I can hear the rain dripping from the branches, and the water is always different. It reminds me of the person I was a couple of years ago, happy in the outdoors, self-sufficient. I would really hope other people with MND might be able to benefit. So yeah, try.
What Alex didn't talk about in that clip, but did in a longer interview I did with him, was about his increased connectiveness with his friends who he swims with now. Until recently, he considered himself to be quite a private person, but he has found new ways of connecting through the support of his friends and being able to rely on people when asking for help. He says that his relationships with others have become significantly more profound. Let's get back to my slideshow. So the green impact for health. I hope you will have lots of ideas what you will do in your surgery when you get there. We need to achieve net zero by 2030, and I see the green impact for health as a pathway for achieving that in the GP practice while enhancing patient care. Everything I talk about here is included in the green impact for health, but there's also a lot more in it. I'm not an expert at all, I'm just a regular GP, and it's my experience of being involved with the green impact for the last 4 years that I want to draw on. I think as GPs, we have a voice, and we also have a lot of opportunities and a responsibility to talk about these, to talk about the climate emergency. We're used to trying things out and seeing what works. We're used to talking about difficult things. It's actually what we do quite well. And if we don't talk about difficult things, who's going to? In the consultation, we choose our moments and we challenge ourselves and we challenge our patients. So the Green Impact tool is a great way to practice. It's a great framework for practicing, for excellent clinical practice, as well as being not just for the consultation. I want to really share some of my positive experience of using the Green Impact Toolkit. For me, it's really helped me to prevent burnout and has certainly reduced my stress. Although its talks don't. I'm going to talk about some of the co-benefits. So we all know about the co-benefits of climate and health. Most of the interventions that are good for humans are also good for the planet and vice versa. We know about active travel, cycling, walking, running to school or work. We know about eating a plant-based diet. We also know about improved installations in our houses. So how about the co-benefits of doing the Green Impact for Health Toolkit? First thing is really obvious, and it's working as a team, collaborating together on specific tasks. In Froome, we had quite a wide range of people contribute to the toolkit, which made it really rewarding. Really, I would suggest that anyone who wants to get involved could get involved. There's lots of things that anybody could do. The waste audit, sorting out green energy supplier is very much a practice manager. And there's a lot of stuff to do with prescribing, which is very relevant to pharmacists. We work very closely with our social prescribing team. Also, there was a great, for me, I had a really lovely relationship with our health connector and our mental health nurse as we set up a Couch to 5K. Which was for patients, but now the couple of the run leaders who are doing it now were originally patients. What we're really, and here are some of the other benefits of the Green Impact. Collaboration, especially with the social prescribing team. We've developed lots of ideas for projects together and been successful in the Climate Action Fund, which is a lottery funded fund. And we're working on projects with other anchor institutions in Froome. There's also a focus on staff well-being in the Green Impact and the benefit of actually getting fit yourself if you join one of these, a similar thing to what we did with the Couch to 5K, or become a park run practice. The experience of patients becoming more empowered is very positive, and the feedback from them is a very positive thing. I talked about Jack in our breakout room, who became a runner at age 68, and that experience has made me feel good as well. So doctors feel empowered when practicing the more holistic, person-centered, personalised medicine, which is very much in line with the NHS plan. We've had some real success with networking. We've linked in with the Centre for Sustainable Health in Oxford, which is a fantastic institution. And they have supported medical student placements with us. And we've done, when they've suggested assessed QI projects, we did one on opiate deprescribing with them. But really what we're talking about, we're aiming for cultural change. We want to infuse every aspect of our life, professional and home life. We want to normalize having climate conversations. We want to mention them. It needs to be on every agenda, and it needs to underlie every decision made. So we look at the impact of decisions on, we look at the cost, and we look at the environmental cost too. In terms of consultations, there are many ways in, especially when talking about lifestyle interventions. More and more acceptable to talk about a daily walk these days. I'm trying to change the culture here. We don't have to be perfect, but we just need to remember it all the time. And one day it will be automatic for everyone to do it. We need to infuse and inspire as professionals. Most of us know we need to do something. We need to do lots of things at all kinds of levels. It can feel a bit overwhelming, and it's difficult, and it can feel difficult to know where to start. Yes, changing your car to electric is important, but it's not the only thing you can do. On a personal level, you can identify, you can measure your personal carbon footprint and identify hotspots and act on them. Our behaviour really has an impact, possibly more than our words. For me, I have pledged not to fly. I've also moved house and job so that I can cycle to work. It's going to make me feel better, and it's going to have a benefit on the environment. How do I share this with others in order to encourage them to do the same? On a professional level, there's a lot more we can do. We need to use our voice, our trusted voice as doctors. We're not quite the most trusted people in society. The nurses get that accolade, but we are trusted. And what's more trusted than a trusted doctor is a trusted doctor that you know. So, and that's exactly what we are as GPs. So we really have a responsibility to use our voice. We need to also get our patients to support our initiative, involve the PPG, and when we had a youth PPG, and obviously in terms of climate use, the young people that have a voice needs to be heard. We should involve our local communities and schools. In Froome, they employed a green health connector, and I think even the fact of employing her has shown that they are serious about climate action. We need to talk about the climate emergency. We need to lobby our big institutions. Our government, who declared a climate emergency, haven't done as much as we'd like them to do. We need to get them to make appropriate actions to reach far-reaching change in order to achieve carbon zero by 2030, well, ideally 2025. This in order to avoid the catastrophic effects outlined earlier. But we also need to practice sustainable healthcare. I'm going to talk about that in a minute. Practicing sustainable healthcare feels like an enhanced partnership between the patient and the doctor, so it feels like a real human connection. Everyone wins: the patient, the doctor, community, the economy, the world I've written here. It feels good. It's all in the Green Impact Toolkit. I just wanted to draw your attention to two websites. One is the Froome Medical Practice website. We hosted a Green Impact conference in February 2020, and the talks are on the website. They're in PDF form, but the people who gave them, I'm sure, would share their slides if you wanted to use them. So use them as a resource. Also, the Greener Practice website run in Sheffield is full of resources. Please use these resources and also contribute to them. So in practicing sustainable healthcare, what we really want to do, I'm going to go through this very, very quickly. In simple terms, we want people to stay healthy. We want to empower communities so that they can support people to live a healthy life. We want to practice preventative medicine and with good management of long-term conditions using non-medical therapies or low carbon therapies when they need medical therapies. We want people to stop smoking, to move more, and to eat a plant-based diet and learn to relax to prevent stress, and get involved in their community groups doing things they enjoy, maybe even trying new things like Alex and his swimming. When they do contact the doctor from this ideal healthy life they're living, we want to communicate effectively and efficiently with them, remotely ideally, because patient journeys before the pandemic were a significant carbon burden on it within the NHS. We want to use our consultation skills to create really strong relationships with our patients so they feel empowered and enabled to make informed decisions about their own management. We need to make this as easy as possible. We need to have cameras and microphones available to us so that we can engage with patients as effectively and positively as possible. And if that happens, if we engage with them well, they're more likely to make positive change. We want to use group consultations to manage these long-term conditions, again, empowering patients to consider other approaches other than just medical prescribing. This has been very successful in diabetes, and I know that locally we're thinking of doing it for obesity and long COVID. We want to investigate less so that we find fewer incidental illness and cause less suffering. We want to refer less and rarely admit our patients. We want to use shared decision-making and safety netting to empower the patients more so they can identify their own red flags. I'm sure it's really obvious, all of this kind of thing. When we do prescribe, we want to prescribe medicines with the lowest carbon options. That's fewer liquid medications. We want to encourage over-the-counter use because there's less waste in this sector. Rather than prescribing opiates and long-term analgesia, we want to refer to the escape pain clinic or a pain management clinic. We're doing one of these in Frome with one of the health connectors leading on this, and it was truly inspiring to be part of that. And we want to encourage people to look after their own well-being. When we do prescribe, we then want to optimize medications and eventually deprescribe. When we do admit them to hospital, we want them to get discharged as soon as possible by having a great community discharge team. So all these things that we practice, they're all relevant to good medicine and the better effect on the environment. We want to empower patients. We want to empower patients to look after their own health. We want them to take responsibility for their health. We want them to make informed decisions. A part of the toolkit of these two things, shared decision making and choosing wisely, where we look at the benefits of the treatment we're talking about and the risks and what are the alternatives, but also what if we do nothing. A truly informed decision may well mean doing far less than is currently the accepted norm. We want to enable the clinician to make practicing sustainable healthcare the easiest thing to do, far easier than prescribing a statin, for example. We want to support the consultations they are making with consultation templates on our IT systems. Currently, I use the 4-pillar planners as part of my consultation and often SMART goals, but there are no templates for these at the moment. So we want to try and get these kind of things into our IT system so it makes it easier. We want to make it really easy to refer to our community connectors or social prescribing link workers. We use F12 in Frome, where we have a referral letters and forms, and also the social prescribing template. We also have a really comprehensive website in Frome, which is a great resource for what's going on locally. We also want to join our green networking groups and share ideas together, and that will really help us all do practice in this way. We do have the tools to enable us to practice in a more sustainable way, and in general, it's associated with really good clinical practice. But are we really? Should we see health as more of a social movement? People in communities engaging in local action to help themselves and others stay well. We need to lobby our institutions, notoriously slow to make change and not yet in the routine of considering the environmental impact of every decision. This has been obvious with the PPE challenges through the pandemic. Where is the evidence for the PPE that we use, the single-use masks, the aprons? We need to challenge these assumptions. And so one of my messages is really to join Revolution Zero and get reusable masks to become the norm. So what will you do tomorrow when you go back to work? Remember Alex with his motor neuron disease. What did he do? What are the things that you're thinking, what you're going to do? Do they actually conform to the SMART goals? Are they specific, measurable, achievable, realistic, and timely? For me, I'm going to order the masks from Revolution Zero and start using them. I'm also going to catch up on some of the social media for DocsFXR, which I've neglected recently. And I'm also going to carry on with my Couch to 5K that I'm doing again, so that I can join these happy volunteers at our local park run finish line. Thanks very much.